Thank you very much, Brother Bobby, for a very kind introduction. Hi, brothers, sisters. Good morning. Sukiotu. Don't know good or not good to see so many of you. Yeah, welcome to this morning's sharing with the title Disease or Dis-ease, Understanding Anxiety with Psychosomatic Symptom. I would like to dedicate this talk to all my patients with anxiety and psychosomatic symptom, wishing them safety, good health, and peace of mind. Yeah. I also like to thank all my patients because they've given me the real life experience on how to overcome anxiety with psychosomatic symptom. So whatever I'm sharing with you today is not just book knowledge, it's clinical experience plus all the things that I actually learned from my patients in my clinic. Okay. Let's start off my sharing with one of my favorite story called Semua Sakit syndrome. Those of you who have been listening to my talk, you know this is one of my favorite stories. Yeah. So story always start with once upon a time, isn't it? So once upon a time there was a old lady, makcik, who actually presented to the clinic with Semua Sakit. Semua Sakit means, of course, you are Malaysian, then you understand, means pain all over the body. Sakit, 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 headache, chest pain, stomach ache, back pain, pain all over the body. Yeah. So any doctors here? If you're a doctor, then the doctor will be very stressed out if the patients will come to you with sakit, semua sakit. Especially if you've done all the investigation, everything normal, but the patients still come to you with sakit, semua sakit. In Chinese, in my clinic, I have a lot of Chinese speaking patients, tong, 呢度痛嗰度痛，周身痛, pain all over the body. Yeah. So if you're the doctor, what do you think is the problem? Mental. Okay, this story has two versions. This story has two versions. Okay, the first version is a medical school version. I used to teach in a medical school, the UPM Putra Medical School. So the medical school version, this lady actually had a fracture of a finger. That's why she got some sakit pain all over the body. That's why when the doctor asked the lady to point to the specific site of the pain, wherever the old lady point, here also sakit, sakit, everywhere sakit, everywhere also sakit. So the medical school version of the story, actually the old lady had a fracture of the finger. So you have fracture of the finger, of course wherever you point, you're going to be sakit. So the medical school version, the professor liked to tell this story during the introduction, the orientation, the first week of the program is to remind the medical student, next time, one day when you become a doctor already, when you talk to your patient, make sure you do a thorough physical examination, including checking the finger. That's a medical school version. But it's a second version. The second version is related to what we are discussing now. Actually, this old lady is having a lot of stress. Of course, in this sharing, I use the word psychosomatic symptom. So it's because of emotional issues, because of stress, because of anxiety, as well as depression that present in the form of physical symptoms. So the mind is connected to the body is connected to the mind. So when we have a lot of stress, a lot of anxiety, a lot of depression, it can be present in the form of physical symptom. Yeah. So that's what I mean by Semua Sakit syndrome. By the way, in my clinic, I have two types of patients who are most difficult to treat. Two types of patients. Of course, I've got many types, but these two types are the most difficult to treat. Okay, one is Semua Sakit, and the other one is Tada Sakit. What is summa sakit is pain all over the body. So they are the one typically referred by other physicians. They are done doctor shopping. Doctor shopping. I work in somewhere medical center. It's doctor shopping in somewhere medical center, not shopping in somewhere pyramid. So they've gone to all the specialties. The doctor say nothing wrong with that, but they still have any sakit. So there's one semua sakit. The other one more serious one is tak ada sakit. Actually, they are very sick, but they don't think they are sick. Which one more serious? Semua sakit is more serious, or tak ada sakit is more serious? Tak ada sakit is more serious, isn't it? Okay. So that means all of you not so serious lah. Because the fact that you come here, that it means you got some sakit lah. So not so serious lah. Those who are not here are the one more serious lah. The one very sakit, but they think tak ada sakit. The one is the more serious one lah. The medical term we call it no insight. So you're very sick, but they either don't know they are sick or they deny they are sick. Anyway, back to this semua sakit. Okay. Okay. So the lady is experiencing what in medicine we call psychosomatic symptom. It's a very big word. In fact, it is one of the words in the title of this morning sharing. The sharing is called Disease or Disease Understanding Anxiety with Psychosomatic Symptom. So what is psychosomatic symptom? Okay, this is very important. Okay. Psychosomatic symptom means physical symptom, bodily symptom. Physical symptom caused or worsened by mental factor. The mental factor means stress, anxiety, depression, or a combination of stress, anxiety, and depression. But present in the form of physical symptom. That's why psychosomatic. Somatic means body. Soma means body. I forgot whether it's the root, whether it's a Latin or Greek something. It's not the English word, but soma means body. So it presents with bodily symptom, physical symptom, but the root is related to psycho. This psycho here doesn't mean psychotic, like those in Tanjung Rambutan Hospital Bahagia, no. The psycho here means psychological or emotional. In simple, down-to-earth term, it means stress, anxiety, and depression. So because of stress, anxiety, and depression, it leads to a lot of physical symptoms. Okay? So what are the conditions which are related to stress, anxiety, depression? So insomnia, panic attacks, generalized anxiety disorder, health anxiety, illness anxiety, depression, and so on and so forth. So these are all the stress, anxiety, and related conditions which can present in the form of physical symptoms. So a lot of people think that emotional issues are just in the mind. Actually, it's not just in the mind. It's in the mind and also in the body as well. So far, so good. So semua sakit is sakit, physical sakit, but it's also related to emotional sakit, stress, anxiety, and depression. Next. So I explained to you the definition of psychosomatic symptom. What are the common psychosomatic symptoms? So these are the common psychosomatic symptoms. These are the common physical symptoms, common bodily symptoms when a person is stressed out. So I just read to you and see which one you have, which one you don't have. Or which one your friend or family member have, which one your friends or family don't have. Heart palpitation, heart beating very fast, breathlessness or shortness of breath, shortness of breath, gasping for air, fatigue, tired, physical tired, headache or head spinning, giddiness, ear ringing. The medical term is tinnitus, ear ringing, ear ringing, stomach ache or wind, gastric pain, chest tightness, back pain, then sometimes too hot, too cold, and the hot can sound like a menopause symptoms, sometimes the vision blurring of vision, frequent urination, constipation, diarrhea, also menstrual disturbances. Dialogue, you got this symptom. These are all common physical symptoms. So in my clinic, by the way I work in the clinic, I do not work in Tanjung Rambutan. I work in clinic, so almost every day, not almost every day, every day, I have patients will come to me with this kind of symptoms, and very often they have done the doctor shopping in the hospital. They have seen all other specialty, all blood investigation done, X-ray done, ultrasound done, scan done, everything done. The doctor will either say there's totally nothing wrong with you, or there's something wrong with you, maybe a small matter only. For example, you get stomach ache, so the doctor has done a scope. Well, they say no cancer, no tumor, no bleeding, no hole, nothing. Maybe just a big gastric pain. Okay? So is the problem solved or not solved? Not solved, still sakit, is it? Yeah. So very often I see clients with this kind of symptom. So one of the most common causes of psychosomatic symptom is anxiety. Now I'm linking the word psychosomatic symptom with anxiety. Psychosomatic symptoms are physical symptoms due to stress, anxiety, and depression. Now I'm zooming into anxiety. Yeah, okay. So what is anxiety? I think the simplest way to explain is anxiety is kanchong. People who kanchong. Another word is 焦慮 in Chinese. People who worry a lot, anxiety, fear. Basically, I think the easiest way to understand is if I ask you to come forward to say a few words, before I ask, I have to ask any one of you who are afraid of public speaking. Those have met me before, you know myself. Those of you who are fear of public speaking, you put up your hand. I won't ask you to come forward here. But put up your hand first. How are you? Fear of public speaking? Okay. So I'll be more kind to you. You put up your hand, so I won't ask you to come forward. I won't ask you to come forward, but I'll ask you to imagine I ask you to come forward. Imagine I ask you to come forward. Of course, you can imagine if you are a bit shy, you have fear of public speaking, ask you to come forward, you have all the anxiety symptoms. You have all the physical symptoms, your heart beating very fast, fear. So that is anxiety. Which is quite common. Usually anxiety come and go. So I say you put out your hands, I said, I won't call you, then you feel a bit relieved. I said, I imagine that you feel a bit anxious. Then I said, now I'm going to invite you. I know, I'm just joking only, then you feel better. So what for the normal anxiety, one, the stressor is over. One, the problem or the stressor is over, then it's gone. It comes and goes, impermanent, anicca. But it has another term called anxiety disorder. So there's another word, anxiety versus anxiety disorder. When you add the word disorder, it's more serious in the sense that it's very persistent. It doesn't just come and go. It stays for a very long time. It's very persistent. It's very intense. It's very frequent. It's very intense. The symptoms are very severe. So frequent and so intense to the point that it can affect our life, daily functioning. Like if you're working, you're unable to work. If you are studying, you're unable to study. If you are a meditator, you're a serious practitioner, it interferes with your meditation. That it becomes anxiety disorder. So what's good? So anxiety is normal. Anxiety disorder is not normal. So if you have anxiety, no need to come to me. It's normal. Anxiety disorder, maybe you got to consider seeking professional help. So far so good, So let's recap a bit. I started my sharing on the Sumo Sakit syndrome, isn't it? So Sumo Sakit syndrome is a creative way to describe psychosomatic symptom. Psychosomatic means a lot of physical symptoms, but it's due to stress, anxiety, depression. Then I zoom into anxiety. There's a difference between anxiety disorder. Anxiety just come and go. Anxiety disorder is more frequent, more intense. It interferes with our daily life functioning. So far, so good, huh? Okay. By the way, some of you are, anyone taking notes? You need to take notes. You can take notes, no problem. But I will give you all the slides. I'll pass to BVF, the PDF version. PDF version of 5. And also, I make short YouTube videos all based on this presentation. I noticed this way people may not have the patience to listen to a 1 hour talk, 2 hours talk. So I still make it into short video clips. So while you're here, I suggest you focus in the present moment, focus more on understanding, focus more on asking questions. Then the next question, a natural question about how do I know I have anxiety disorder? So I mentioned anxiety and anxiety disorder both can give rise to psychosomatic symptoms. Anxiety and anxiety disorder both can give rise to psychosomatic symptoms. Of course, for anxiety disorder, it's more severe. Then the natural question will be, how do I know whether I got anxiety or not? Anxiety disorder. Okay, one of the simple way to know is to do a screening, online screening, a questionnaire screening known as GAD-7. Forget about the one on the right. Pay more attention to the one on the left. It's called GAD-7. So later when you have the slides, you can just scan the QR code. There will be an online questionnaire. So it's called GAD-7 because there are 7 questions. Basically, it asks about certain symptoms over the past 2 weeks. This is screening. This is not diagnostic. It's not confirmation. Okay, if your score is more, if 10 or more for the past 2 weeks, and it's somehow affecting your life quite significantly, then you might have anxiety disorder. So I repeat, so all you do is just scan the QR code. You don't do it here, go it when you get home. You do the questionnaire, you will automatically come up with a score. The most minimum score is kosong. But kosong also sometimes can be more serious, you know. The kosong can be the tala sakit type. But anything less than 10 is quite alright. Anything less than 10, I would say is a normal stress. Anything less than 10 will be the normal stress. Anything more than 10 and is somehow affecting your life quite significantly, then you might have an anxiety as well. Not only, not confirmation. Okay. Okay. So I already explained 2 of the terms in the title of this talk. I talk about anxiety. I talk about psychosomatic. Then another very important word is disease versus disease. You still remember the full title of this talk? Disease or disease. Understanding anxiety with psychosomatic symptoms. Anxiety disorder I explained. Psychosomatic I also explained. So now I'm going to zoom into these 2 words, disease or disease. If you understand this concept, then you can go home already. I tell the same thing to my patients who have done all the doctor shopping. They come to me. I will write these 2 words, disease and disease. And the way I write it is like, what, fu, what's fu or not? So I scribble, I say, okay, you must understand the difference between disease and disease. Once you understood already, I say, okay, no need to come back. No need medicine, no need therapy, finish. You graduate from the clinic. That's the importance. Okay. First, we start with disease. Okay. Disease is a medical condition or illness with clear physiological causes. So, example of disease is heart attack. Heart attack is a disease. Stroke is a disease. Diabetes is a disease. Hypertension, high blood pressure is a disease. Cancer is a disease. Peptic ulcer disease is a disease. Got it? Then what is disease? The second one, the blue one. Disease. So there's a dash. Disease means discomfort. Ease means comfortable ma. This means not comfortable lah. So this is the state of physical discomfort. So the most important thing is this is uncomfortable, okay, and this is often due to stress, anxiety, depression. So one is a penyakit, 一個係有病 is a disease, is an illness, 有病 high blood pressure, stroke, diabetes. Okay. The other one is disease is 唔舒服 uncomfortable. If you want to relate to the Buddhist teaching, disease is under the category of Vedana, feeling, okay, unpleasant sensation. So technically, a disease is unpleasant sensation. But unpleasant sensation is not the same as disease. Got it? Got it? Can go home with it. Got it? You can go home. If you're not sure yet, stay. Not sure yet, stay. Okay. I'm repeating the same thing just in a slightly different way. Okay. So disease involves actual structural damage. Structural damage. So when the doctor say after you've done all the doctor shopping, the doctor will say there is no disease. Okay, but sometimes the word no disease is very confusing. So I have to make it clear in my clinic. I will make it clear. Okay, what does that mean? That means no cancer, no growth, no bleeding, no broken bone. No this big stuff. But don't have all these diseases doesn't mean there is no disease. So no structural damage. Disease still can see a disease because disease involves bodily discomfort or pain. So a bodily symptom does not always mean a serious sign of illness. Of course, a bodily symptom can be due to physical sickness. I'm not saying that a bodily symptom cannot be due to a sign of, cannot be due to severe illness. But if you've done all the doctor shopping, you check everything, doctor say everything normal, so we can more or less conclude there is no sign of serious illness. But it's still disease. Got it? Maybe I'll pause here for you to clarify. Our pause here. Anything you want to clarify on this concept? This is 唔舒服 is not the same as disease 有病. Wow, no question. Very good. My explanation is so good. Okay, not so good. 99% good. Still got a question. Very good. Okay. Fever can be a disease. It can also be a sign of the severe disease. Okay. Let me repeat. Okay. Fever can be a disease. It can be also a sign of a severe disease. Okay. Okay. It can be a sign of severe disease. For example, cancer can present with fever. Of course, most of the time fever is just disease lah. It is nothing serious. But fever can be a sign of serious medical condition, like cancer, like rheumatoid arthritis. They are more severe conditions that actually cause fever. I mean, I use cancer is the easiest lah. Cancer, of course, is a severe illness. So fever can be a sign of severe illness. So does that answer question? But if you've done all the doctor shopping in some way medical center or any other medical center, they have checked, they investigate thoroughly. Your fever, nothing serious. They will say it's just a disease, uncomfortable, unpleasant sensation, a Vedana which is unpleasant. Clear? Okay, 98%. Yes.
Can I bring you back to the second slide that talk about the symptom?
Psychosomatic symptom.
Yeah.
Okay.
Because how about things like stomach acid, bodily pains, and like sometimes unknowingly we blinding the teeth, or sometimes can be at night in the middle of the night while you're sleeping. So what are those?
Those are, first of all, they are symptoms. First of all, we start can you see the cursor? Oh, you can't see the cursor. Is there a pointer? The cursor, does the cursor come up? There. No, cursor doesn't come up. Pointer got. But never mind. Let's zoom into the word symptom. Those are all symptoms. Symptom is what you complain or what you report. I have a seat, is right. What you report to the doctor. Whatever you can say, whatever you say to the doctor is a symptom. Whatever you complain to the doctor is called symptom. A sign is what the doctor can see. If I say, headache, I got a headache, that is a symptom. But if the doctor press, ayo, sakit, that is a sign. Technically, you learn a little bit of medicine, basic medicine. I say, headache, very painful, that is a symptom. But the doctor press, really painful, that is a sign. So basically, what the list you told me, they are either sign or symptom. Of course, a sign and symptom can be due to severe disease, or it can be just disease. So they are either sign or symptom, and the sign and symptom can be due to severe disease or just mild disease. So this sharing is in the context of people who have seen many doctors. They have done all the doctor shopping, especially in the medical center. Especially tertiary or all the methods, they got all sorts of sophisticated medical equipment. They've done all the investigation and they say there's nothing wrong. So when they say nothing wrong, but it still have all the sakit, semua sakit, so this talk is in that context. So if you have those signs and symptoms, you've done all the investigation and they say nothing wrong or nothing serious, then we can say that is due, those signs and symptoms are disease. Unpleasant sensation, but they are not disease inside, is not due to severe disease. So far so good? 2 can graduate already. 1 more waiting to graduate. Yes, yeah. Long way to go, yeah.
So can I sum it up as saying the shift or the discomfort come and go, or is a persistent pain the patient is experiencing all these symptoms constantly every day to say that they are disease or disease or
we cannot use the frequency, cannot. Frequency cannot. That is not the main criteria. I would say the main criteria is when you have semua sakit syndrome, the list of signs and symptoms, and we have consulted many doctors, and they say there is nothing serious. That is the most important criteria. Because you talk about symptoms, sometimes the symptom is not very severe, but it can still be very severe. The symptom doesn't sound very severe in the sense that it's very mild and it's transient, it comes and goes, but that can still be serious. Got it? So that cannot be the most important criteria. And sometimes the symptom is very intense, it's very frequent, actually it's nothing serious. Once I have food poisoning, very intense, but it's nothing very severe. It just lasted one and a half day, then it disappeared. So that is not the main criteria. Got it? Yeah. But I suppose people don't think too much about it if it's just short term. It is the recurrent. It is the recurrent, there's a pattern of it's recurrent. It's come and go recurrent, and you consulted many doctors, It is that context. Okay, 3 can graduate. One more.
My question is about insomnia.
Yeah.
How about insomnia? Is it a symptom? Is it caused by disease or caused by disease?
So you go to the doctor, say, doctor, I cannot sleep. So technically it's a symptom. Then if the doctor say, oh, you have a lot of eye bags, that one is a sign. Or you look like zombie, look like zombie is a sign. And that can lead to psychosomatic symptoms. When we don't sleep well, that can lead to psychosomatic symptoms. So if we don't sleep well, is it something severe or not severe? It depends. Insomnia can be very severe. Insomnia, cannot sleep, can be very severe. Insomnia can be very severe, but it's not a severe physical condition. So you have to ask sometimes when you are kanchong, when you are scared or you kanchong, where I try to find out what are you fearful of, what are you kanchong about, and for different people it's different, For some people I say, oh, insomnia is also serious. They say, doctor, insomnia I'm not worried. I only worry I got cancer only. So they're not worried about the insomnia. They worry about cancer. But another patient, the worry can be something else. Oh, I'm not worried about cancer. I worry about insomnia. So different people will have different worries. So I do not know your exact worries. But the point is, insomnia can be a sign, can be a symptom, and that can lead to psychosomatic symptoms. So if you understand, then you're not so kanchong lah. So you just do whatever you want to do, metta meditation, loving kindness, improve your sleep quality, then the symptom will be less, then you worry less. Okay, how many more want to graduate? Yes.
Wait.
Yeah.
Recording, please use this.
Oh, recorded lah. You get psychosomatic symptom already.
I kanchong already.
Yeah, your heartbeat also recorded now,
Yeah.
Your blood pressure also recorded now.
Yes, doctor, I'm curious, right? For someone who stay in a disease state for a longer time,
Disease,
will it eventually become a disease?
it depends. If you worry about it, yes. It's nothing serious, but you worry, then it becomes a vicious cycle. Which I'm going to share with you more afterwards, but just a glimpse of it. Okay, it is just disease, nothing very serious. But when you worry about it, it will amplify it. Because when you worry, the nervous system is the system, the Sanking is more sensitive. When you're more sensitive, you feel the disease more. When you feel the disease more, if you understand, then never mind. If you don't understand, you're going to pay more attention to it. Got or don't have? It's like your heart rate increase. Then you pay, increase what? You cannot feel. You say. So actually, it's quite alright one. When you think what you cannot feel, then it becomes fire. So if we understand, we don't worry too much. We understand that it's alright. But if you don't understand, we keep on worry, and worry leads to certain behavior will also worsen the worry. People who worry about health, the behavior, generally there are 2 categories. One category is they worry, they avoid. Avoid, that means don't come to talk like this, don't go and see a doctor. You avoid doesn't mean the problem is solved, Actually, you avoid, you worry more because you don't attend talks, you don't find out more, then the wrong views are there. Because the other type is a doctor shopping type. You go from one doctor to one doctor. So either one, the problem is still not solved. Short answer is, if you understand, it's alright. If you don't understand, you worry more, then it becomes serious. Any more? Okay, let me continue. Okay. Where did I stop myself? Okay. So with the understanding, sometimes after we have understanding, we need a short phrase to help us to remember. Mindfulness. Mindfulness means remembering, mindfulness is not just present moment awareness, but remember. So after understanding, remember. Okay. So this is one of the coping statement. So when you have the kanchong, si or cham or jala or ayo, the moment you catch the kind of thought, then you replace with this coping statement. This is disease, not disease. My body is stressed, not broken. It summarizes it very well, isn't it? Yeah. Good summary. So if you cannot remember the rest, remember this. This is disease, not disease. My body is stressed, not broken. So the disease that is bodily discomfort. My body is stressed. The severe illness should go a bit higher than the arrow, the disease level. Good. Okay. So after you have now you have better understanding, like right view already, like Noble Eightfold Path, start with right view. You have better view already. So now if you have a friend or family member with this disease, what are you going to tell them? Now you're more knowledgeable, better understanding. What are you going to tell them? Are you going to go back and tell them, "Don't see lah. Dr. Phang says it's all in your mind or all in your head"? Are you going to do that? Are you going to say 心理作用? What? 心理作用. It's a common phrase in Chinese, no? Are you going to go back and tell your family, "Hey, Dr. Phang say 你心理作用啦," or Dr. Phang say it's all in your mind and body? And the Dr. Phang quote the Buddha. The Buddha also say the same thing. Yeah. And the answer is no. We need to be wise. Not just knowledgeable. We need to be wise. Wisdom is how to apply the knowledge, how to apply the understanding. That is the wisdom. So how are you going to explain? My explanation is a bit lengthy. But when you talk to your friends and family member, they don't have the chance to attend this talk. So you may want to give that a simple explanation. So this is one of my explanation. I like to use the concept of nerve sensitive. Because you ask doctor, you said there's still nothing wrong with me about how come I still feel all the sakit. My sakit is real. So I said, yes, your sakit is real. It's not 心理作用. It's not all in the mind. Your pain are real. I'm not saying that it's fake. I'm only saying there is no severe disease. No severe disease and no sakit is too different, Get it? Ting. No severe disease and no sakit disease are different. Okay? And then naturally, they'll ask how to explain it. You say no severe disease, but I'm still sakit, I'm very uncomfortable, I'm very unpleasant. Then I use the concept of 神經線敏感, nerve sensitive. Because when we are stressed, when we are anxious, we are kanchang, the nervous system is too sensitive. That's why you amplify. I also use a simple analogy. It's like a smoke alarm. Smoke alarm is supposed to detect smoke. Suppose if we smoke, like people smoking, then you detect the smoke. But sometimes the system is too sensitive. You got a piece of breath, just toasted one, a little bit of smoke. It's oversensitive. You thought there's a fire. So it's oversensitive. You can use different analogy. You can use the nerve sensitive, you can use the fire alarm. Or another analogy I use, sometimes when you use, you go internet online yourself, there's a thing called the firewall, isn't it? Firewall is meant to protect the computer. But sometimes the firewall, too sensitive. Everything is so block. BGM also block. KL Buddhist mental health also block. Too sensitive. So the system is too sensitive. So this is a simple way to explain. Okay. If you want a more scientific explanation, some people they are happy with that explanation. Just 神经线敏感. The fire alarm too sensitive. Or the computer firewall too sensitive. Some they are happy with it, with that metaphor. But some people they are more scientific minded. They want more explanation. Also can. whatever you want lah. My clinic is like a menu like that. Tell me what you want lah. You want simple one, I explain simple one. You're more scientific, I'll give you more scientific one. In case you are the more scientific one. By the way, let's have a little survey. How many of you here you prefer the more scientific one? More scientific one. More scientific one. Okay, this one for you lah. Okay, the rest you can sleep now. Okay, more scientific and biological explanation. Okay, it still goes back to the nerve lah. It still goes back to the nerve. Okay, but you have to imagine a bit. Nerve is not an abstract concept. When people say 神经线, nerve is not an abstract concept. We say mind, mind maybe is a bit abstract. You cannot, we know what the mind is, but you cannot show them. Can you show me your mind? You can't show your mind. But actually we can see nerve. Nerve is not an abstract concept. If you do anatomy, you cut open the body, you can actually see nerve. Usually in pictures is represented by yellow, something yellow in color. So you can imagine, you imagine, but actually can see what nerves are all over the body. So nerves are not just in the brain. So there's another misconception. People think that nerve is only in the brain. The brain is the headquarter. But from here, you got nerve that goes to every part of the body. Every part of the body. And because the nerve is sensitive, so that is the biological explanation why we feel the semua sakit in semua part of the body. Because nerves are found in every part of the body. And that a nerve helps us to sense things. And that explains why we have the semua sakit in semua part of the body. Get it? I perfected my explanation over the years in my clinic. I try again and again and again and again and again and again. If you are not sure, feel free to ask. I'm happy to learn. I'm happy to learn from you. I'm happy to know what you don't know. I'm happy to know. I like to know what you don't know. If I know what you don't know, then I can revise my explanation so that you get it. If you don't like the nerve explanation, there's another explanation, hormone. So when we are stressed out, not only the nervous system is sensitive, the brain also produces a lot of hormones. And by definition, hormones circulate in the blood. Am I correct? Hormones circulate in the blood. They don't just stay in the brain, they actually circulate in the blood. And we have blood vessels to all other parts of the body. And that is also a way to explain how we can have semua sakit in semua part of the body. So you have the nerve explanation, you have the hormonal explanation. Okay. If you still not convinced, there's another concept in traditional Chinese medicine called 精神衰弱. The English term is neurasthenia. Neurasthenia. How about this term? 精神衰弱. 神經衰弱. Okay. 神經或精神? I'm a 精神醫生 or 神經醫生? You ask like that. I'm 精神科醫生 or 神經科醫生? Quiz question, You ask that? Yes, I'm 精神科醫生 or 神經科醫生? 精神 Yeah, correct. 精神 So this one not my field lah. I'm 精神科醫生 So this one 神經 is not my field lah. The terms are a bit confusing lah. You're right. Okay. 神經精神衰弱. Okay. It's actually this term is very interesting. But I try to understand the history. I'm not sure about you. When I first heard about this term, my first impression is traditional Chinese medicine, or at least traditional medicine. But interestingly, it actually originated from Western medicine. This word, 精神衰弱, Neurasthenia, it actually originated from Western medicine. But from Western medicine, it was introduced to China. Then the Westerners forgot about this concept. They don't like this concept. They come up with a new concept like anxiety disorder. And they forgot about it. But it got popularized in China, in the traditional Chinese medicine. Okay, there's an advantage of maintaining this term. But basically, it's a concept related in TCM. There's a word of qi imbalance, but energy imbalance. Okay, it's a concept energy imbalance, and these are the typical symptoms. A description of neurasthenia, 神经衰弱, tired, psychosomatic symptoms like dizziness, muscle pain, heart palpitation, stomach ache, insomnia, irritability, poor concentration. Very similar to anxiety with psychosomatic symptoms. But they don't use the word anxiety. They would use the word 神经衰弱. I think it's more culturally acceptable. Also 神经, not 精神. So you see the stigma is less. The stigma is less. So when you go back to your friends and family member, see which concept you think is more acceptable. It can be simple as using the metaphor, the smoke alarm system too sensitive, or general nerve too sensitive, or you can use the hormone imbalance, stress hormone, or you can use the TCM method. 神经衰弱. As long and by the way, all these are scientific. It's just different model, whether you want to use the nerve model, or you want to use a hormonal model, or you just want to use the metaphor, or you want to use the concept of qi. To me, is the truth is the truth lah. The truth is the truth lah. Just like four noble truth is four noble truth lah. You can have different ways of explaining the four noble truth, but the four noble truth is still the four noble truth. So this truth is still the truth. It just different people use different concepts, different terminologies, different way to explain the same truth. That's how I look at it. Okay. Okay. I have talked about anxiety and anxiety disorder. Now I'm going to zoom a little bit more. I'm zooming in a bit. I started with Sakit syndrome and psychosomatic. Might affect the body. Okay. And psychosomatic, I say, is stress, anxiety, depression. I zoom into anxiety disorder. And now I'm going to zoom further into anxiety disorder. Anxiety disorder are many types. The one that I see in my clinic, there are 3 types are most common. There are many types, but 3 types are most common. Okay. One is called panic disorder. The other one is generalized anxiety disorder. And the third one, not here in the next slide, is called illness anxiety disorder. Okay, so pay attention. But anyway, this is the detail. If your memory power is not good enough, whatever you heard just now, this is the most important one. You think you still got battery, your storage still got, then you can continue. I talk about generalized anxiety disorder first. As the word generalized means that everything also kacau. Everything also worry. It's not just health, everything also. Of course, include health, but everything also kacau. Yeah. Don't know what to eat, also kacau. Nothing to eat, also kacau. Eat too much, also kacau. Can sleep, also cannot sleep, also kacau. Sleep too much, also kacau. Got dream, also kacau. No dream, also kacau. The word general, it really means general. Everything. My mom has generalized anxiety disorder. So my mom is the textbook for me to study general anxiety disorder. A textbook. Everything. Everything also kacau. It's not only health. But health is a big component, but everything. Panic disorder is also kacau, but it's not kacau about everything. Panic disorder is the anxiety symptom. Remember earlier, there's a slide on all the anxiety symptom. For panic disorder, it's very special because the anxiety symptom is very intense. Can you recall some of the symptoms that I mentioned in the earlier slide, anxiety symptom? Can you recall? Heart palpitation, shortness of breath, breathlessness, diarrhea, stomach upset. Okay. So for panic disorder, the symptoms are similar, but it's very intense. So intense to the point that you may want to rush yourself to the emergency department. Or it's intense enough for me to stop the thought or stop whatever you are doing. Maybe you need to go to the washroom, or you go to the emergency, or you go to the tree. It's so intense. Okay? Then typically, because it's so intense, it's not like, oh, who come out and say a few words, no lah. Just sample only lah. It's not like, oh, who come out and say a few words, it'll be kanchong. No, it's much more than that. The physical is very intense. You kanchong until is, oh, bring, call the ambulance, bring me to the emergency department. Then, of course, you do hospital, they check, and they say, congratulations, nothing wrong with you. So that congratulation, I don't know to congratulate or not to congratulate. Because they check, nothing wrong with you. Then they may say, oh, maybe you got panic attack. Then they suggest maybe you go and see the 精神科医生, and then more panic some more. So that's panic disorder. And the fear is you fear that those symptoms will come back again. Because doctor say nothing wrong. But the symptoms are still coming back. So the kanchong and fear is related to this. But they don't fear about other things. Not my mother. Not like can sleep also worry, cannot sleep also worry. This one is very specific because the symptom, you don't know when the symptom will come back. Okay, so you don't dare to go up. You don't dare to come today. What happens if you see here suddenly the symptom come? What to do? Go to emergency. Doctor say nothing. So that is panic disorder. Okay. Then the third one is illness anxiety. Illness anxiety is not generalized. They don't worry about everything. In panic disorder, at least something already happened. You got the physical symptom. It's very intense. In illness anxiety disorder, actually the symptom is very mild. The symptom is nothing very serious. Not like panic attack. Illness anxiety, the symptom is very mild. But because we don't understand, we kanchong, we worry that it amplifies. You got it? That's illness anxiety. Well, if you don't want to go into detail, it's alright lah. You just take it as health anxiety lah. That's why the title of this theory is called Anxiety with Psychosomatic Symptoms. You just keep it general health anxiety. But you want to understand more, then you got the generalized anxiety. Everything also kanchong, including the health. Then you have a panic disorder, panic attack. Yes, same symptom but very intense until you bring you to the emergency department. Then you have the illness anxiety. The symptoms are not very severe, but because you don't understand, you go to many doctors, and they say they cannot find the cause, you are more kanchong. So they have a common feature. What is a common feature? Kanchong. Worry. Anxious. That is the characteristic feature. Okay, I'll stop for a while for questions. Yes, yeah. Recording. Kanchong already recorded.
Doctor, this generalized anxiety syndrome, is there any treatment for this, or is this is just the character of the person? He's always anxious when
got treatment, of course, got.
So is there
the question is generalized anxiety disorder, the kanchong, whether there is proper treatment. Yes.
There's treatment.
It's proper treatment, but the treatment is not a physical treatment. The treatment is not the physical treatment. It's not going to more doctors. It's not going for more scan and investigation. So there are treatment that focus on coping with the worry, fear, and anxiety.
I see.
So there's a treatment. The treatment is to focus on coping with the fear, worry, the anxiety, and kanchong. The treatment is not focusing on doing more investigation.
I see.
Yeah.
And then another thing, recently I saw from news this boy in the school, he go and step and kill the girl in the school. So what is he suffering? And,
What is he suffering? Oh, I don't know. I wasn't there. I don't know.
and also, as parents
Yeah.
of the boy, how do they detect this thing
Yeah.
and take action? And as the friends of this boy, how do they be aware of this and then avoid this person?
I prefer not to comment much on that because there's too many comments in the social media. I suggest we just keep the beginner's mind. There are a lot of things we do not know yet. So do not speculate. What we can is we radiate loving kindness to everybody, not just the victim. We radiate loving kindness to the girl's family members, to the victim, the perpetrator, inverted comma perpetrator. We radiate loving kindness to everybody. That is the best way. One day when there is a conclusion, then only we discuss further. Anyway, that is not related to psychosomatic. I don't think there's any psychosomatic component. Okay. Yeah. So your first question, yes, for generalized anxiety disorder, not only general anxiety disorder, all the kanchong panic disorder, general anxiety, health anxiety disorder, there's a treatment. But the treatment is not focusing on doing more investigation. The focus is on how to overcome the fear, overcome the worry, overcome the kanchong. There is, yeah. Yes, I saw a hand just now. Yes, yeah.
Hi, morning. My name is BI.
Hi, BI, yeah.
Hi, I want to ask about the panic disorder, right? They say have the panic attack. Is there actually have a trigger factor to the patients that cause the panic attack?
Is there a trigger?
Trigger factor, it must
trigger
be
factor.
something like trigger, then only they will have the panic attack. Or it just come out from, they don't know the reasons.
Very good question. Very good question. Yes and no. Yes and no. Yes and no. It can have a trigger. It can also happen without trigger. Yes and no, but I want to highlight more on the no part. The reason is simple. If there is a trigger and you get a panic attack, at least not that bad. Again, how many of you are afraid of public speaking? I promise I won't ask you to come forward, but if let's say I ask you to come forward, let's say only, but I won't. I say only, I won't. Let's say I say only, I won't. But if I really ask you to come forward and then you got a panic attack, at least you're not too worried because you know there's a trigger. Make sense? They say no need, then you feel better already. At least you know there's a trigger. But the problem is in panic attack, it can happen without trigger. In fact, that is part of the definition of panic attack. But the way the word panic in a panic attack or panic disorder as a medical condition, the meaning is different from the usual, the general language, English usage of the word. It's a different meaning. Different meaning. Right? So in medically, is those symptoms very intense and it can happen without trigger.
So what's the difference between panic attack and panic disorder? You have
you have many times of panic attack. Then you go doctor shopping, and then they tell you nothing wrong with you, and then naturally when you cannot find the cause, you start to avoid everything. This one don't do, that one don't do, don't exercise, don't eat this, don't eat that, don't come to BGL, don't go there, don't. Then your life becomes smaller and smaller. One day you cannot work, cannot meditate, cannot study. Then it becomes panic disorder. If you have only one time panic attack, I had panic attack. I did not have panic disorder. I had panic attacks before. And interestingly, once I had a panic attack while giving a talk on panic disorder. I take pride in that. I don't think anyone can break my record for that. I had a panic attack while giving a talk on the panic disorder. I only had one or twice, but I know. Of course, I went to check out because panic attack is very intense. When I had it, I thought I had stroke. Because my symptom was suddenly my mind goes blank. Like I'm talking to you now, I'm very clear. But by the way, I also conquered public speaking fear because I attend BGF effective speaking course. BGF effective speaking years ago when I was a young adult and teenage years So I conquered public speaking long time ago. But there's one time when I was talking like that, suddenly my mind goes blank. Blank. Cannot talk. I look at my slide. Blank. I look at you. Blank. I imagine the blank and I look at you. You look at me. You got so many eyes looking at me. Imagine that kind of. And it's not due to fear of public speaking. At least if you know of fear of public speaking, okay I know because I'm scared of public speaking I can go and learn VGL effective speaking course. And the mind blank. So of course I'm not young, uncle age already. I thought I had a stroke So I went to my colleague. Went to the neurologist. 精神科 or 神經科? Neurologist is 神經科. Sometimes I also confused. Neurologist nothing wrong, it's not stroke. Then he said, not stroke maybe heart attack. Ayo, more 緊張more 緊張Went to the cardiologist, so I did all the tests What is that? They do ECG, they do the stress test, they do the heart echo. Then there's something called Holter. You take home monitor for 24 hours, 48 hours. Clear. Congratulations. Dr. Phang, you don't have heart attack, you also don't have stroke. For me, okay because I understand. Imagine if you don't have the knowledge, you're very confused, I'm having so severe symptoms, and you tell me there's no problem, and you say congratulations. 唔知係恭喜或唔恭喜Okay. So back to the because it can happen without trigger. It happened without trigger, but I noticed there's a trend. So when you are experiencing the panic attack, you may not have trigger at that moment. But I see a common pattern. Very often is due to accumulated stress. Not at the moment of having the panic attack. Maybe recently, a few weeks ago or few months ago, or maybe you have been experiencing stress for a very long time. Sometimes the stress is so chronic, it's so long-standing chronic to the point that you don't feel it anymore. You heard of the term boiling frog syndrome. You've been boiling for so long already that you say got stress or not? You say no stress. Actually, you've been boiling with stress for so long already. So it's accumulated. So very often in my clinic, when I ask more, a few weeks ago, a few months ago, last year, past few months. Then very often you see the accumulated stress, a little bit here, a little bit there, accumulated. Then the 神经线, the nerve become very sensitive. And then you get a symptom. Okay, that's the pattern I noticed. The Buddhist term maybe is the causes and condition. That's the causes and condition that I noticed. Okay, then the causes and condition will continue. You go to a lot of doctors, they say nothing wrong with you. Oh, more stress. And what still they say, your no stroke, no heart problem, maybe other things. Especially in a medical center, there's so many specialists and sub-specialists, super specialists, and going from one hospital to one hospital, doctor shopping, that is also stress. That's a different layer of stress already. Get it? Okay? There's a different layer of trigger. So when I talk of trigger, there are also many layers, They not necessarily have the immediate trigger. You have the accumulated stress trigger. Then you get it. Then you go to the hospital, doctor say nothing wrong with you, but the symptom come back. That is also another form of stress and trigger. Another layer, family members. Doctor say no problem already. Why you still sakit? It's all in your mind. You better go and meditate. But you meditate cannot, very restless. Then you start to have guilt. Maybe something wrong with me. Maybe bad karma. See how the stress will go, vicious cycle, From one layer, it go to two layers. Like 九層高like that. So that is also one way I explain my clinic, like 九層高. So when you disease, is one layer only. This is one or two layer only. But you add this one family stress, doctor stress, add, 九層高嘅啫。Not the 龜九層高啦 but the stress is 9層 9. Okay, to add on to that, you can even have a panic attack while you're happy. Just now I said, you can have no trigger, I mean neutral. But the most confusing part, you can even have a panic attack when you're happy laughing. Laughing. Would you be more stressed if while you're laughing watching cartoon, watching something happy, and then you get a panic attack? Would you be more stressed or less stressed? More stressed, right? If there is a trigger, okay understandable. No trigger, worry more already. Not happy, also trigger, then you get very confused. Very confused. Okay? So that can happen. Sorry?
In what circumstances? Can you give us examples when you're happy?
You go for family trip. So you already done all the treatment, then you go for family trip, you bring your family member, bring the children, and then you watch cartoon with your children. Then your children together, family laugh, okay? Or you can hang out with your friends, maybe yum cha at the BGF, you talk to your friend, and then you're actually quite happy one, this is a friend, you're quite comfortable one, but then you laugh, happy, then suddenly,
Oh, okay.
Okay. Interesting, isn't it? It's not interesting. If you don't understand, it's suffering, not interesting. Not interesting, suffering. But if you understand that, it becomes interesting. Okay. So the explanation is very simple. Okay. Just now I said all this anxiety panic is 神经线敏感 the nerve is sensitive. Specifically, I'm referring to the sympathetic nervous system, or the fight and flight system. To make it this simple, you can imagine we got many 神經線 one. So there are many wires, many roads, many wires, many highways. So one of them is called the sympathetic nervous system. Okay? Sympathetic nervous system is a system actually designed, all of us, it's not that you're sick only you got this system. All of us have this system. It's called a fight and flight system. It's meant to protect us. Okay? So if there's a fire now, what are you going to do? Run. But how are you going to run? You have to activate the sympathetic nervous system, also known as the fight or flight. Fight or flight. If there's a fire, you don't fight then you fight Are you going to fight the fire? No the bomber will do the job You fight Let's run away It's a sympathetic nervous system that prepares us to run. So when you need to run, of course your heart rate must increase, right? You have to run. You need more muscle power, so the body will tense up, isn't it? You need to run. You need to breathe faster, So all these symptoms initially is meant to protect us. If there's a fire, it's meant to protect us. Only if it's a fire. But the problem with anxiety disorder, or all this kanchong syndrome, it's too sensitive. Too sensitive to the point, even you laugh, actually when we laugh, our heart rate increases, You realize when we laugh, laugh, actually the heart rate increase, the breathing also increase. You notice that? When you're happy, the heart rate increase. Heart rate increase, the breathing also is faster. Or excited. Sometimes you watch cartoon, you're excited. Happy, excited. But from a nervous system point of view, the brain cannot differentiate your heart rate increase because got fire, or the heart rate increase because got dinosaur, or the heart rate increase because you're happy, or the heart rate increase because you're excited. So the system cannot differentiate. So you cannot differentiate like overprotective. It will send you the signal. If you read the signal wrongly, you say, wow, this is dangerous. Then the system will be more active. If you understand, you tell the system, oh, I'm okay now. Now I'm with my family member, with my Kayana Mitra, supportive environment. I'm actually happy. I'm actually excited. It's an okay one. Then the nervous system will be updated. The program will be updated. Can? So there's a long answer to your short question. Your original question is very simple, right? Panic attack can happen with trigger or without trigger.
In another way, actually, you have an awareness, right? Like
Yeah.
One day, suddenly you have a panic attack.
I want to ask question.
Go hospital to do a thorough checkup.
The first time must go and check. I went to check. The first time must go and check.
Very kanchong, if you open your mouth, the mic is not with you.
I'm done.
That's your kanchong lah. Your kanchong and her kanchong will be different. Yes, first time must go and check. So this talk is in the context of you check. You done all the doctor shopping and you still have the small sakit. Please don't get me wrong. Don't go back and tell your family member, both become taginsi. If you are not checked, the both taginsi. Must go and check one first. I went to the cardiologist to check. Where they check, nothing. Then you're going to use all the principles I explained today. Yeah, very important. Don't tell them okay, then end up with heart attack. Okay, can I move on?
Doctor,
Yeah.
regarding the panic attack, is there any sign that suddenly the thing happened? Or like, for example, let's say somebody talking to himself, sometimes in the bathroom like that, talking or shouting like that. Is it the panic attack?
No, unlikely. The panic attack, the characteristic feature is semua sakit, but it's a very intense semua sakit. It's very intense. How intense? Because intense or not intense is relative, I mean, if I ask you to come and say a few words, tell me your understanding of what I say so far. That is also she'll be panicky but it's different from your panic to the point you need to go to emergency department. And I'm not exaggerating. The physical symptom, the heart palpitation, the chest tightness, the shortness of breath, the hands tremor, the giddiness is so intense that you have to stop everything. Like I said, I had a panic attack while I'm giving a talk on panic attack. I had to stop the session. But that was not my first one, so I didn't rush to the hospital. But my first one, I was in my clinic. I had to stop all the consultation in my clinic and rush myself down to my colleague downstairs. So it's that intense.
How about shivering or something like that?
Yeah, it's shivering, but again, you see, there's a difference between shivering or maybe too cold, just adjust the aircon. Compared to you shiver to the point that you scared something, maybe I will die, something bad will happen. Panic attack is that intensity.
So there's a panic attack.
There's a panic attack.
Okay, thanks.
There's a panic attack. So I like the word, it's not just panic, it's like an attack. I like the word attack. It feels like really like a heart attack. It feels like a heart attack. The only difference is when you check with the emergency department, they say nothing wrong with your physical heart. Okay, good. So let's
Wait, hold your horse.
She kanchong that is not recorded. And you are kanchong, the mic comes to you.
Thank you, sister. Sorry, I didn't introduce myself earlier. My name is Grace.
Hi, Grace,
I think his question is very interesting. I notice more and more children and adults talking to themselves. I think that was your question, right, brother? What if someone is talking to themselves in the shower? I see children talking to themselves while waiting for food, waiting for their transport. What is happening?
If your question is why do people talk to themselves? Of course, there's a whole topic. I can give a whole talk on that. But I want to relate to what we are talking now. So I make it simple. I said panic attack talking to yourself is not the common symptom of panic attack. So I
Different
try to
thing.
make it brief lah. Because you want to talk out of the topic very wide. Like for example, the case you brought up, you can have a whole talk on that. Why people talk to themselves, you can have a whole talk on that.
So it's nothing to do with disease or disease. So it has nothing to do with a real disease or their mshifo. Nothing to do with that. Is it?
Those of you who have been attending my talks, you know my style. Whatever question you ask, usually I say what? It depends. I try to give a brief answer. Brief answer. Okay. It can be a disease. But disease can be physical, can be mental. The most serious form of disease that can happen with talking to yourself is schizophrenia. 精神分裂, schizophrenia. It's a very severe form of disorder, but it's a emotional or mental health disorder. It's not a physical disorder. But you can say it's a brain disorder. It's a very severe form of brain, emotional, psychological disorder because they have hallucinations. So they may seem like they are talking to something. Actually, they are talking to the invisible voices. So it appears as talking. Get it? So that is the most severe form. So it's under diseased. Severe lah. Okay. Then you have a milder one. A lot of people, they are lonely. They are lonely, they also a bit stressed, so they talk to themselves. So that is not so severe one. Okay. There are people also talk to themselves because they're very positive. They are practicing affirmation. Budang saranang gacchami, Dhammang saranang gacchami, Sangham saranang gacchami. Or I also sometimes talk to myself. I say, though the body is sick, the mind shall be healthy. That's what the Buddha said. Though the body is sick, the mind shall be healthy. So I may mumble to myself. Of course, you cannot hear what I say. I may sing to you. You get it? So it can be very severe disease. It can be mild, just loneliness, stress, talk to themselves. Or it can be something positive. So it's a reminder. Reminder. Okay. Then I always joke in my clinic. I always say, in my clinic, I got plants. I got a mini garden. So I tell them, I talk to my plants. So they say they talk to themselves. I also talk. I talk to my plants. I talk to my plants. Just make sure they don't talk back to you. Make sure they don't talk back to you. You talk to the plant, it's all right. Talk to the plant. I talk to my plant. I say, may you be well, may you be safe, may you be healthy. And also I radiate metta to my plant. I radiate metta to my patient. But so far they don't talk back to me. Okay, shall we go on? Okay. So more of behavior of people with anxiety, psychosomatic symptoms. I already mentioned about this earlier, just a bit more detail. So one type is a care-seeking cycle. Care-seeking one is people who go for doctor shopping. Then they go to many medical centers, one doctor to another doctor, second opinion, third opinion, fourth opinion, fifth opinion, sixth opinion. Sometimes go hospital also, they're not enough. They go to monks, they go to nuns, go for blessing, go for chanting, go for meditation, they go to everywhere. So that is a care-seeking cycle. That means they don't give up. They still want to find the answer to make sure there's no problem. They're waiting for somebody to say and convince them that there is nothing wrong with you. That's the first type. The second type, avoid. They don't want to meet the doctor. Guess why they don't want to meet the doctor? It doesn't matter if 精神科醫生 or 神經科醫生 or whatever 醫生 or doctor, they don't want. They avoid. Not denial. No, they got problem. In denial. Denial or what? Oh, they are sick. They're so much sakit. They are sick. They are not denying that they are not sick. Interesting statement. Denial of sakit or denial of not sakit? Denial of sakit or denial of not sakit? So this is a slightly different category. Remember, I started the talk. One group is sumo sakit, the other group is tada sakit. For this group, they actually know they are sick. but they don't want to go to the doctor because what the doctor says is very confusing. I sumo sakit and you tell me congratulations, no problem. And worse still, sometimes you go to the doctor, you get more frustrated. I tell you the doctor don't take me seriously. They say nothing wrong with me and send me back. And you pay so much money no more. So they refuse. They don't want to go. And sometimes they go already, they also scared. They also scared the doctor will say, oh, finally we found something. Also scared. That one maybe is denial. Scared. Or the doctor tell me to do this, all the tests. Do also fun, don't do also fun. Do also dukkha, don't do also dukkha. Basically, whatever the doctor say also dukkha. You say I have no problem, doesn't solve my problem. You say I got problem, a lagi problem. You say I got problem, lagi problem. You say I don't have problem, I'm also confused. But this one is still different from the general anxiety disorder because not all the anxiety is still all around, all related to health. So there are two behavior. Then of course there is a inverted comma middle way one. Middle way you shift between switch between care seeking and care avoidance. Care seeking you just shift. Sometimes you go doctor shopping. Sometimes you just avoid. And then there are different causes and conditions. I'm using Buddhist term. There are different web of causes and conditions. Why some people more of care seeking? Why some people care avoidance? Why people switch? Generally, there are internal factors and external factors. Internal factors and external factors. To give you an example, external factors one. Okay. Let's say your insurance coverage. And it's a medical center, we can do every test you want and your insurance cover. You're more likely to go or less likely to go? More likely, insurance cover, no need to pay. Go. So that is an external factor. Then depend on the doctor. Doctor also got two type one. One type is do. Nothing to lose, do. You're not sure, check some more. So now you're more likely or less likely to go? More likely, Some doctors are more traditional, no need lah. You just go BGL, learn meditation, chanting, no need lah, okay one lah. You listen to the Phang talk, okay one lah. Go to Sifu, learn meditation, you'll be alright one. Some doctors are more conservative. They also influence the decision. So these are external factors. Of course, there are the internal factors. Internal factor is how I think. If I think that, hey, doctor don't tell me I go and see a doctor. The more I tell, the more they investigate, and the more problem I have. Usually I come to them with one problem. Now the doctor tell me I got second problem, third problem, fourth problem, fifth problem. So it's more internal. Then more likely for me to go or more likely for me not to go? More likely not to go okay. So it's all internal and external factors. Any question on this about the behavior? Wow, you are the trigger. I gotta get panic attack already. You see, nobody dare to ask already. Nobody dare to ask already. Okay. If no question, then we go to the treatment. Okay, treatment. The treatment, the solution, the management. Okay. The most effective treatment, I'm talking about non-medication. The most effective non-medication treatment from a modern medicine perspective is a kind of therapy called cognitive behavioral therapy. Cognitive behavioral therapy. It's a form of treatment, but it's not a physical treatment. It is a medical. It's a psychological treatment. It's a medical treatment, professional treatment, evidence-based treatment, but it's not physical. It's not about doing more tests. So it's called cognitive behavioral therapy. Not criminal, but breach. Not criminal breach of trust. So I learned from my patient. In my world, CBT is something very positive, very wholesome, very healthy. But in the working world, CBT is criminal breach of trust. Is a negative connotation. Okay. So I'm going to share with you some of the principles in CBT. In short, basically, it's changing the C or changing the B. C is cognition. But the simple thing is changing the thinking, changing the view so that you have right view, right understanding, and simple. B is behavior, changing the behavior so that the behavior become more helpful. Of course, T is therapy. So whatever I'm sharing is based on the CBT principle. You see, there's a lot of similarities with the Buddhist teaching as well. Hey, everything starts with right view. Agree? Noble Eightfold Path starts with right view. You start with the right understanding why you have so much sakit when the doctor say you don't have a serious sakit problem. So you go back to the explanation. You either the nerve explanation or the hormone explanation or the 神经衰弱 explanation, the qi explanation, or the smoke alarm explanation. People need an explanation. It starts with an explanation. Right? Okay. Then this one very important. Get a trusted doctor. Usually I recommend get your family doctor. A family doctor who knows your condition well. The family doctor knows whether you are the kanchong type or the not kanchong type. Kanchong type has a different way to investigate. The not kanchong type has a different way. The not kanchong type, whether are you the kanchong type or non-kanchong type, it comes to your health. Let's do a survey, simple survey. Those of you who are the kanchong type, in terms of health, it comes to health, you are the kanchong type. Okay, those not kanchong type. Okay, the not kanchong type, we have to scare you, Scare you, young, don't think young cannot fall sick, The Buddha say young also can die, also can fall sick one. So the non-kanchong type, you have to scare them a bit, pressure a bit. But kanchong type cannot, people with health anxiety cannot. So you get your family doctor who knows your condition well. The family doctor functions as a gatekeeper. The family doctor will tell you, this one is necessary to investigate. This one, not necessary to investigate. This one, just treat in the GP clinic will do. This one, need to refer to the medical center. So this family doctor, very important. It's like a gatekeeper. Okay. And behavior, don't consult Dr. Google. But in clinic, I've learned that when you tell people not to do it, they will ping go and do it. Remember some of my previous talk, I thought was the pink elephant experiment. There's a experiment in psychology called pink elephant experiment. So they ask the participant not to think about pink elephant. When you tell people don't think about pink elephant, they will think more about pink elephant. So I ask them not to Google, they will Google more. Okay. So over the years, I also evolved. Thanks to my patients. That's why I say I'm very grateful because they tell me different problems. I get to know what they don't know. That also I evolve my ways. So nowadays I'm more advanced already. Instead of telling not to Google, I still do that. But that is my first line. First one, I say don't Google. Some are very quiet, some very good. Some they just trust me. Some are very quiet. But some are more stubborn. Okay? Someone that I give you two, that I'll say I give you two options. One, you don't Google. Second one, if you Google, you let me guide you how to Google. You let me guide you how to Google, and you Google in my clinic. So which one you prefer? I give you a try. Don't Google, or you Google in my clinic, I guide you how to Google. Which one you prefer? Second one, so you're not the quiet one. You're quiet. So I give you a choice. So why do you think I give the second option? Of course, based on the psychology, you cannot tell people don't do this. You say don't do this, people are more likely to do this. So I give that another option. Then when they show me the Google. Most of the time, how people Google about symptom. Most of the time, how people Google. Let's say you got chest pain. Let's say you have. You give me one symptom.
Cause of insomnia.
Cause of insomnia or cause of chest pain. Okay. In fact, most people go straight. Can chest pain be due to heart attack? They will go there. Can heart attack cause chest pain, or can chest pain be due to heart attack? Okay. If you that is the most jalak one lah. I say most jalak one lah. Most jalak one lah. You say can heart attack cause chest pain, or is chest pain due to heart attack? That is the worst one. Because that is similar to, is like, can a plane crash? Can a plane crash? Sure. So you're asking Google, can a plane crash? What will Google tell you? Yes. Okay. You ask Bante, can a plane crash? But they cannot musawada one ma. Yes, it can crash ma. Can crash, isn't it? Say, Bante, the Reverend, Sifu also say can crash, you know. Then you're trapping yourself. If you ask a bit general, still alright lah. You ask a bit general, what are the causes of chest pain? Little bit better. But usually internet, they will emphasize all the more severe one. The first few things that come out, heart attack. Or sometimes I get another option these days, upgraded. ChatGPT is slightly better. Please don't get me wrong. I'm not encouraging you to ChatGPT. I'm just saying that if possible, don't. Find a good GP doctor. If you cannot, if you don't have a good doctor, go and find one good one. You go and discuss with your doctor. If you cannot, I think you compare Google with ChatGPT. I think ChatGPT is better, safer. But the problem is, GPT, Google, different company. I'm not promoting any. Okay. But problem with ChatGPT is sometimes you ask the correct question, but you don't read everything. You read the chest pain, you say, yeah, it can be due to heart attack. But later part, they say it can be also due to disease, not severe disease, but you don't read that part. That's the problem. Or usually the same information, there will be another one at the bottom. I say, no matter what, please discuss with your doctor. You don't read that one. You only read the part, can the plane crash? Yes. Can this cause heart attack? Yes. Can this be due to stroke? Yes. Can this be due to motor neuron disease? Yes. That's a problem. That's why I said, either you don't Google, you discuss with your doctor, or if you want to Google, I will teach you how to Google. Fair enough? Okay. Okay. This sounds straightforward. Because the psychosomatic symptom is due to overactivation of the sympathetic nervous system, and therefore any form of relaxation exercise you do can help. You just choose the one you like. You want to go for yoga, also can. You want to go for qigong, also can. You want to listen to chanting, also can. You want to listen to music, also can. You want to do meditation, also can. You want to do mindful walking, also can. Anything that helps to relax the body and calm the mind, they will all work because they will soothe the nervous system. And please don't go and make life complicated. Say, my qigong is better than your qigong, my meditation better than your meditation. It's complicating life. More stress. You activate the nervous system. Just straightforward. You just choose whatever you are comfortable that can help to relax the body, calm the mind. Of course, if you want to start, you don't know where to start, of course, you can go to my YouTube channel under the Kuala Lumpur Buddhist Mental Health Association. I have a playlist on the kindness practice, which is basically combination of mindfulness and kindness on various ways to relax the body and calm the mind. Like mindful body stretching, mindful breathing, body scan, everything to help to relax the body and calm the mind. This is not the best. The best is the one that you are comfortable and you can maintain. This one, I think I can... No, I won't skip. This is important. Again, a bit on traditional Chinese medicine. I'm learning a little bit on traditional Chinese medicine, so I can incorporate that into my counseling. In TCM, it's a very interesting concept. Every organ is connected to an emotion. Any of you have some idea about TCM? Anyone here? None. Yes. So in TCM, every organ is connected to an emotion. Okay. For example, liver is connected to anger. Anger. Liver. That's for liver. Liver. 肝臭. 肝臭 besides the liver is also being irritated. Right? So I like this concept. Well, it is not a specific connection. It's not like, oh, you got anger, must be liver problem. Or you got fear, it must kidney problem. That's not what I mean. But the overall concept that the body is connected to the mind. I like that concept. So in TCM, it's like common sense. In TCM, it's almost like common sense, that the body is connected to the mind is connected to the body. Is something not right with the mind, any mind emotional imbalance, it will affect the body. It's almost like it's a common sense, Whereas in Western medicine, the dichotomy is too clear. The mind is mind, body is body. TCM, they are strongly connected. Okay? So that will mean besides relaxation exercise, anything you do can help to regulate the emotion. That also be helpful. Anything. Can be counseling, can be play therapy, anything that can help to soothe the emotion will help to soothe the body. And so I explained earlier that psychosomatic, the soma body part is due to psycho, which is stress, anxiety, depression. But often my patient will tell me, Doctor, I have no stress. I have no stress. Can you help me to counsel the patient? Yeah. They say no stress. So you say all these psychosomatic symptoms, there's an emotional component, TCM concept, then you got stress, anxiety, depression, nerve sensitivity. I have no stress. I have no stress. Help me. Anybody can help me? SOS. I'm very stressed. The patient say no stress. Yeah. I have to admit, sometimes it's stressful in counseling because the worry, the kanchong is like it's very, very super creative. You cannot think of way people worry. So I also sorry I cannot find the answer. So that gives me a little bit of stress.
So
Dr.
Phang,
yeah.
So I will ask Dr. here.
Okay.
I will ask the patient, if you have no stress, no problem, why are you here? Why is he here to see you?
My stress is semua sakit lah. My stress is semua sakit. But doctor, you say my semua sakit is because I'm stressed. My stress is semua sakit. But you tell me my semua sakit is not a problem, it's because of stress. But I don't have stress. You see how stressed I am when I hear this? Help me. Let's make this session more
Maybe
interactive.
it's a choice of word. He doesn't like the word stress.
Okay. Good point. So no stress. Maybe keksim only. Keksim. So good point. So change the word. No stress. Keksim. No stress. Heartbroken only. Heartbroken. So that's a good point. So you use any term which is related to stress. No need to be so fixated with the word stress. So what are the terms are related to stress? Keksim. Stress and emotion keksim. Kanchong. They say I no stress, I kanchong only ma. So that's one point, one possibility. So actually they have stress, it's just they don't call it stress. Maybe they call it dukkha, they just don't call it dukkha. I got dukkha, I don't have stress. Help, I'm very stressed already. Patient in front of me.
Anybody else?
Help. Who? Help me. So they don't understand what is stress. They say they don't have stress, but they don't understand the concept of stress. Okay. For example, a stress can be external. A stress can also be internal. So a lot of people, when they say stress, they think of external. My husband, my wife, my children, my boss. They're thinking about external. So they say stress means external. They say I don't have external stress. But actually, from a psychology point of view, stress can also be internal. High expectation is also stress. They ask, do you have high expectation? Yeah. I didn't know that that is also stress. Yes. So from psychology point of view, that is also stress, but it's more internal. So awareness on stress, external, internal. That's one. Help me. Less stress already. Got 2 person help me. Don't use the word stress, use other term. Educate them. Awareness, stress got internal, got external. Who else want to help me? Help me. Actually, just now a question already answered that. Sometimes the stress, no stress now, accumulated stress. No stress now, accumulated stress. You ask 1 month ago, 3 months ago, 6 months ago, 1 year ago, then it's so obvious. Okay. Got one more. I got two more. Then we go next slide. Okay. One more is I also learned from my patient. Sometimes when they say I don't have stress, what they actually mean is I'm not supposed to be stressed. When they say they don't have stress, actually what they mean is I'm not supposed to be stressed out. Okay. For example, I'm a psychiatrist, I'm a psychologist, I should not be stressed. So what they actually mean is you're not supposed to. Then you can open up a conversation. Then you can ask, is there anything that you think you shouldn't be stressed? Then the conversation will open up. I'm a counselor, I'm not supposed to be stressed. I'm a doctor, I'm not supposed to be stressed. I'm a monk, I'm a nun, I meditate, I shouldn't be stressed. So what they mean is they shouldn't be stressed. They shouldn't be stressed and they are stressed, and that will make them more stressed. Another one is, the last one, really too free, nothing to do. Too free, nothing to do. Too free, nothing to do. That is a form of stress also. It's not an external, but it's too free, really too free. Too free plus too intelligent but not wise. Too free. Now got AI. ChatGPT not enough. Also Google with not ChatGPT, then they go for DeepSeek plus Gemini and all the symptoms. A lot of time, too free. After retirement, too free. But check all the symptoms. Then also sometimes pay attention to the wrong thing. Awareness, but wrong application of awareness. Go to BGF center, learn about awareness. It's correct. The awareness must be right. But now they aware the wrong thing. The aware got symptom or not, got symptom or not, got symptom, aware. They got GPT, that make things too free. Too free is also a form of stress. Okay. This one very important. This one is Thought-Scientist. Basically, challenge the thought. Okay. So you have to first we start with noticing the thought. Noticing the thought. What could be the thought be? 慘咯, 知咯, 慘咯. Am I sick? You start with that. Then you go to the middle part. Basically, we learn to be objective. What is the evidence? Let's say the fever. You brought a fever. What is the evidence that my fever is due to severe illness? What is the evidence that is not? What is the most likely? So you sort of self-talk. This one self-talk. This one also talking. But this one is talking to yourself. Or talk to the tree, talk to the plant. But this one is a healthy talk. This fever, I already saw my doctor. Also went to the specialist. In fact, second opinion already. The doctor said fever, no problem. So okay lor. But Buddha say life is uncertain. Now no problem only. Later might have problem. So you say is talk. Okay. So evidence for, evidence against. So it's like two-person talking. Then you hopefully you come to a middle ground. Yes, everything is possible. The car can crash. The plane can crash. But how likely? A bit unlikely lah. I already do all my thorough screening. I got a good family doctor. Also good physician, good surgeon. Got a second. It's less likely lah. So I focus on what I can do now lah. So it's talk to self. But this is a healthy version lah. Talk to self. So you talk. Okay, hopefully when you can talk in a wholesome way, talk in a healthy way, talk with wisdom, then shift focus. So the awareness will shift. Then for the awareness, there are a few ways to shift lah. After you've done the talking, okay, one way is just keep yourself busy lah. Keep yourself busy lah. Doesn't have to be wholesome. As long as you don't harm people, as long as you don't harm people, just keep yourself busy. As long as you don't harm people, just keep yourself occupied. The Chinese phrase that I say is 要精神寄託啊，要精神寄託. As long as you do something, as long as you don't harm people, no need to meditate also never mind. But you want to meditate even better lah. Or go to listen Dhamma talks and even better. But as long as you are occupied. Okay. If not, back to the earlier slide, anything to do with relaxation. Yoga, Qigong, walking meditation, chanting, meditate, anything that can help with relaxing the body, calming the mind, that will also helpful. So you got two options. Keep yourself occupied. 2, anything that help to relax the body and calm the mind. Of course, the third category is even better. Go and do something wholesome. Do something wholesome. Generate good karma, generate good supportive karma. What we can do? Do meritorious action. Go for mindful walking. I like mindful walking. I gave a talk previously on mindful walking. Mindful walking can help to relax the body, calm the mind. It's also very good because there's a physical fitness component. It also helps mindful walking. Then after that, you can do dana, food offering, generate the good karma to support good health. So you get it? So if it starts with mindfulness, notice the thought. You must notice the thought first. Notice the demon, the inner demon, the so-called the Mara of health anxiety. Notice it. Then examine what is evidence for, what is the evidence against. It's self-talk, but positive, healthy self-talk. Then shift focus. Either distract or relax or go and do something wholesome. Can I? Anything you want to clarify over here?
Wait, one by one.
Bante got sharing?
Hello.
Hi.
Dr. Phang, I'm Raymond.
Mana sakit?
We understand the thought of scientists, but for the patient of the anxiety disorder, it's very difficult for my experience. It's very difficult to ask them to shift the mind, change the mind. The continuity of the thought is there, and then they can't get away of that. Even after medication for almost 2 years, it's coming back. After taking medicine for 4 months, stabilized, but after another 4 months, come back again. Some because of the medication issue, like the side effect of medication or creating more problem, like trembling or shaking or whatever. But after we come back again to another medication course, and another 4 months, stabilize again, but again, after 4 months, still coming back suddenly. Or maybe because of the flu, taking the medication of others, there's against the medication of the anxiety disorder.
So what is the question?
So the question is there any possible...
The question is very important, because the question is related to the aim of treatment. The question is wrong, aim of treatment is wrong, treatment will also be wrong.
So from the medication side, well, that is a complete cure or full recovery?
No.
No?
Actually, I will say no.
Then
No, full stop. No.
beside the medication or TCM or whatever, what is the solution? Let's say.
Very good, very good. That leads to what is the aim of treatment. What is the aim of treatment? If your aim of treatment is the symptom never come back again, that's impossible. That is almost like dukkha, Four Noble Truths, dukkha. Of course possible enlightened. If you're not enlightened yet, dukkha will come on and on. So the aim of treatment is not to get rid of the symptom. The aim of treatment, everything I've heard, is the aim is to help us to cope with the symptom, and so that we can move on with our life in whatever we want to do in life. It's very important. It's related to the aim of treatment. Otherwise, you'll be lost. Attending this talk, I thought after attending this talk, I have this solution that the semua sakit will never come back. You'll be disappointed. It's not about never come back. It's about how to cope with it so it's not so intense. Not so intense possible. Not so intense possible. Not so frequent possible. Not so intense. Not so frequent. And the most important part is when it's not so intense and not so frequent, how are you going to move on with your life? For me, I had very severe panic attack. It's always my dream to do this kind of sharing. So I'm able to share now. I am very grateful because that is my goal, that's my mission, that's my purpose in life. I still on and on have the disease symptom, but it doesn't affect me. I'm still active giving talks and sharing. So it's the functioning which is the goal. Coping with the symptom so that I can function, that is the aim. And doesn't matter what method. It can be involved medication or non-medication. Doesn't matter. Medication or meditation, the aim is still the same. Can I? Can I? Yeah.
Right. Thank you. Just now, Dr. Phang, you have the slides on be wary of Dr. Google, right? And I noticed with the recent visit to clinic, we have GPs that relies on ChatGPT. Should we be wary of that? Because ChatGPT, this large language model, they have the tendency to hallucinate sometimes. So if let's say our GP relies on that and we also we indirectly rely on this LLM, then will we get this wrong diagnosis and should we be wary of that?
Good question. Thank you for asking. Yeah. Most of my answers will be along the lines of it depends. It depends. Okay. If a doctor, doesn't matter what doctor, any doctor, a GP doctor or if a doctor use ChatGPT or any AI alone, that means fully rely on the AI to make diagnosis and treatment, of course, I think that is very harmful. Okay, that is very harmful. Okay, but if doctors are using AI to support the diagnosis, support the assessment, support the diagnosis, and support the treatment, I think that is very useful. So I repeat, it depends. If the doctor is using AI alone to make assessment, diagnosis, and treatment, that's not the correct way. Harmful. Hallucinate, can get wrong information. But if doctor use that as a way to support, that is very useful. Okay. Do I use that? I tell you how I use. Okay. First of all, I never use AI. I never use AI to make diagnosis. No, I don't. The diagnosis is based on me. Okay. But sometimes, if you practice long enough, then you feel some certain patients that we call it treatment resistant. You have no idea is whether the treatment is correct or diagnosis. Sometimes you get the AI to give input. Of course, you can also ask your colleague. You cannot rely on just the AI. You consult your peer colleague. You also get the input so you can think outside the box. But it's never as the That's the main. I also use AI to help me to do explanation. Okay, for example, I know the concept of this somo sakit. Okay, but I asked ChatGPT, how can I explain this to my patient so that it's easy to understand? Add in some meta and wisdom. That's how I use it. And I find that sometimes ChatGPT give very good suggestion. And especially, we can actually condition the ChatGPT. We can actually condition the ChatGPT. So it's a positive conditioning. So in short, is how we use it. How we use it. I don't think any doctors will use ChatGPT alone. And for your information, besides ChatGPT in the hospital setting, we have actually AI is specifically for medical use. You can say it's medical grade. Medical grade AI. Because GPT is very general one. So in the hospital, for example, now there's a thing called the drug interaction checker. So sometimes you're on traditional medicine, you're on other medicine. So there is an AI who can actually analyze the drug interaction. But it is not at the GP level, it's more at the medical grade level. So it's the drug interaction checker. So I have a few AI. GPT is only one of them. Hospital, the different ones. Yeah, thanks for asking. Yeah.
Dr. Phang? Dr. Phang?
Yes, yeah.
Okay. This talk is basically about disease and not so much of the disease.
Not about disease, yeah.
Yes. And you've already given the treatment plan right on the slide there, where you're supposed to examine evidence, challenge your belief.
Correct.
Okay. My question to you is this. If a person does practice this, he or she has a disease like a cancer survivor under remission for 5 years, but creeped thoughts about negative stuff comes creeping in, or even something less severe, like autoimmune disease, your lupus or rheumatoid arthritis. You're under medication, it's being controlled, but you still feel the inflammation and things like this. But you know that this is probably the stress of a daily life and things like this, handling families, children, work, and things like this. So even knowing that it could be psychological and whatnot, you as a doctor, how do we examine our thought and have a mind shift? Especially you examine the evidence. Well, you do have, example, you are a cancer survivor. You do have the disease and it may come back. How do you shift your thought? How do you challenge the belief? That's what I'm more interested in. As a person with disease-based and not just disease. So how do you tackle that?
I got it. Because previously I already given a talk on the disease part. And the good thing is Vijay had done the recording, the editing. We actually uploaded in the Vijay website and also in the KL Buddhist Mental Health Association website as well. The title of the talk was the body is sick, the mind shall be healthy. The body is sick, the mind is healthy. So that one is betul-betul sick. Whereas today is disease. It's not even a real physical disease. But the other talk was focusing on the real disease. That means really sakit. So when the body is sakit, how to keep the mind healthy. So I've given a whole talk on that. So that's why I'm not emphasizing on that. But that one has been uploaded either in BGF YouTube channel or in Kuala Lumpur Buddhist Mental Health Association. In fact, there are many versions of that. There's a full version. There's also a summary version and short video. So maybe you can listen to the talk to complement with the current one. Okay. Then another aspect I want to highlight is maybe this part. It is meant for friends and family members, but you can also use the same skill for ourselves. It's the concept of validating the distress. Validating the distress, which is different from explanation. So sometimes our loved one, sometimes they are not looking for explanation. Sometimes they do, sometimes they are not. So if you think they want an explanation, then you can use my whatever I share with you. So this is a nerve sensitivity or all this thing. If you think they want an explanation, okay? But sometimes I notice our friends and family, they are not asking for explanation. They're asking for kindness. They're asking for compassion. They're asking for metta. So no amount of explanation will help. Then maybe we can switch gear. We use this term called validation. Instead of explaining, you're okay, that is explanation, assurance. Validation will be the phrases sound something like that. I can clearly see that this has been troubling you greatly. So you have cancer, you're on treatment, but it's understandable that you have fear of relapse. I can clearly see this is troubling you. It seems that you're really worried that you have a cancer relapse. It's important that you know I believe in your symptoms are real and it is troubling you. These kind of phrases. It's understandable that your mind jumps to the worst case scenario. It's understandable despite that you consulted a doctor, saw a psychologist, come for talk, right? It's understandable that on and off you still have the symptom. It makes sense that you want to check. It makes sense that you want to do everything possible to minimize the risk of relapse. So the strategy is slightly different. It's not so much on explaining. It's more of a connection, showing love, showing care. So this can be applied in two contexts. One context is for our loved one, our friends and family member. Okay? We can also learn to talk to ourselves. Back to that one, talking to ourselves. We can also learn to talk to ourselves in this way. Got it? Yeah. Again, relating to the question that the brother asked here, it is never about getting rid of symptoms. It's never about getting rid of symptoms. It's all about reducing the intensity, reducing the frequency, so that we can move on with our life. Yeah, you want to be a good doctor, you want to be a good psychologist, you want to learn the Dharma, you want to be a good mother, good father, you want to continue your education, you want to do voluntary work. It's always about managing those symptoms. Doesn't matter whether it's medication, meditation, or therapy. It's always for function in life. Okay. I have a lot more slides, but I prefer to just flow with you, so that I will attend to your questions. Okay. Any more questions? If not, I just show 1, 2 more slides and see whether there are any questions. Can I? Okay, good. Okay. Should I consult more doctors? Okay. I will say, if you are very sure already, if you're very sure, sure means that you have been to medical center, you have been to second opinion, third opinion, and all the doctors say are quite consistent. That is not necessary anymore. But you're at the stage which is doubtful, you're at the stage which is doubtful, then of course, by all means. But if you have a friend or family member with health anxiety, I strongly suggest that you should accompany them for the consultation. This is very practical advice, because people with the health anxiety tend to misinterpret information. So we can be there to help to make a decision. Sometimes what the doctor explains is very clear, it's straightforward, nothing. Then if it's straightforward, then we get it, then not necessary anymore. Sometimes you can sense that actually it's still not clear. It's still not clear, of course, you can go for a second opinion or third opinion and make sure the explanation is simple and understandable and relatable. Right? Okay, good. Should we investigate more related to that? Should we investigate? Should we see more doctor? Again, it depends. If it is very clear, then no need. Okay? But if it's very clear, but they still cannot tahan. Sometimes it's not about the answer of whether there is a problem or not problem. It is, I know there's no problem, but I still cannot handle. Okay? Then there are certain strategies back to challenging the thought, do relaxation, distract yourself. or you still cannot tahan, you set a waiting period. This is called like a bit exposure therapy. So I cannot stop you from consulting another doctor, but at least you can delay the period. Delay. So delay. Usually immediately you will call the doctor, now you delay for 1 week. Because the delay is reprogramming the brain. Delay is programming the brain. In fact, we think that, if I got a symptom now, I straight away can call the doctor, straight away can get the appointment. Actually, it's not really good. Of course, you can meet the doctor says nothing, you are temporarily okay only. But you are training the mind that, a symptom equals disease equals disease. So the pattern will repeat. So you want to change. Our brain is neuroplastic. You want to retrain the mind. Actually, it's disease, but it's not disease. But you see, whatever we are doing now is at the intellectual level. It's at the knowledge level. Disease is not a disease. It is at the intellectual level. You want it to be experiential. Experiential means that you got a bit discomfort. Then you do meditation, distract yourself, keep yourself occupied. Then the thought, the feeling come and go. That is the actual programming. It's experiential programming. Okay, I'll go to the just last two slides. As I mentioned previously, I gave a talk on this title. Though the body is sick, this one is betul-betul sick, sakit. Though the body is sick, the mind shall be healthy. So I gave some suggestions on how to overcome that. If you're interested, you can scan the QR code. You can access to that talk. There's a full version. There's also a summary version. So sister, try this out. So integrate whatever you learned today and also whatever you learned from the previous one. See whether it can help you to serve the challenges in life better. Okay. This one. This one last slide. If you find this talk useful, you want to share with your friends or family member. Actually, I produce short YouTube videos. All the topics are related to what I'm saying, but I actually make them into short video, 5 to 10 minutes on various aspects of I shared today. So you can scan this QR code, then you bring you to the YouTube channel of the Kuala Lumpur Buddhist Mental Health Association, which is a Buddhist organization that focus on mental health. Then you get access to all the YouTube videos, including one of the last one I just created this morning. What would the Buddha say? What would the Buddha say to people with health anxiety? So it's medical perspective, psychological perspective, and also the Buddhist perspective. Feel free to access this. Okay, with that, thank you very much. I can stay. I'm not in a hurry to go. But I leave it to the MC to decide how we're going to proceed.
Thank you, Dr. Phang, for the very beneficial and relevant talk. We'd like to give a small token of appreciation to you.
Thank you. Thank you. Thanks.
Today's talk will be uploaded to YouTube. You check Buddhist Gem Fellowship YouTube channel and also KL Mental Health channel. Okay, so you can take more questions.
I can.
Okay, another 5 minutes for questions.
Okay. Those who want to leave, you can leave, no problem. Those who you can leave. Thank you for attending the talk. Stay healthy, stay happy. I'm around to ask to attend the question.
Dr. Phang, my name is Kang, just like to ask a question. The treatment plan for this anxiety disorder, why is it? It's just for coping and it's not to cure it. The treatment plan, you're saying it's just to cope with the anxiety. Why is it just coping and not to cure the anxiety?
Good question. Very often, when people want to treat anxiety, they want to get rid of it. So there's a principle in psychology. Whenever you want to get rid of something, it becomes worse. So we have seen this pattern. So we have to adjust the aim. So the aim is reduce intensity reduce frequency, and you're able to cope, when you give the instruction in this way, naturally it will be better. If you tell them you're here, I will give you a cure, no more symptom, guarantee better, it will get worse. This is play around with psychology. And so true, the most important thing is to function in life. And that also related to the treatment principle, because having a purpose in life, so the purpose is very important. But because this is a general public talk, I cannot go too much into the purpose. Having a very strong purpose itself is an antidote, is a treatment. It's not only a distraction. Having a purpose in life itself is a treatment. Got it? So I'm using my example. So I'm very grateful now I have good health to do this sharing. But doing this sharing give me a lot of joy. It is meaningful. I'm sharing here, I also make the YouTube. That give me a lot of joy. The joy before doing this. I spend hours. I'm only here for 2 hours. But the number of hours I spend for this talk, making the YouTube, is hours. And the clinical experience, years. So the joy before, the joy during, and the joy after, the joy itself is therapeutic. The joy itself is therapeutic. And with that, there are two possibilities. Of course, one possibility is you are cured. One possibility, you are cured. The second possibility, you are not fully cured, you are better, but you still move on with your life. Okay. That leads to another concept, very important. Okay. You can never get rid of anxiety. So the analogy I use is, let's say you got fever. Doctor give you Panadol. After you treat Panadol already, then your temperature you check is normal. Normal is how many?
7.
This one something wrong. Normal is 37 degrees Celsius. Correct? Correct? Can the temperature be 0? Temperature cannot be 0. Okay? So even temperature is normal, is not 0, it's 37 degrees Celsius. Another analogy. Let's say you got high blood pressure. Okay, high blood pressure, the doctor give you medicine and then your blood pressure is normal. So what is the normal blood pressure? What is the normal blood pressure?
120, 80.
120, 80 is not 0, 0. Okay? It's not 0, 0. And so this is a very important concept because anxiety can be normal. Because it's anxiety from a biological point of view, is the fight and flight system. It is a system. That the computer has an antiviral program. The computer has a firewall, and that is normal. The problem with a lot of people with anxiety, they want to get rid of the firewall. They want to get rid of the viral program. They want to bring the temperature from 37 to 0. They want to bring the blood pressure from 120/80 to 0. And that is the problem. So the expectation itself is the problem. Yeah? Yeah.
Thank you.
Very good question. Thank you for asking. Yeah. Yeah.
Any more questions?
Tak ada sakit lagi. Got question, yeah. Ada sakit lagi.
The treatment for the medication is what the function actually?
For medication, very good, very good. Thank you for asking. Okay. A lot of people think if you take medication, whatever medication, after a certain period you'll be cured, and that is a problem. It's exactly like you take Panadol. You take Panadol, 2 tablets, 3 times a day, 4 times a day, then your temperature will become 0. That is the problem. So we rarely, when it comes to anxiety disorder, we rarely use words like cure. To other people, maybe this cure recovery is positive. It may sound positive to you, but it comes to the actual therapy, it's positive, but it's not helpful. Because it will set the expectation is wrong. Okay. Then does that mean that medication is no good? No, I didn't say medicine is no good. I prescribe medicine as well. Okay. The whole idea of taking medication is to reduce the sensitivity, to help to reduce the sensitivity. And you can do it in many ways. For example, you mentioned something about insomnia. If you don't sleep well, the system is going to be more sensitive. So at least you got medication, safe medication for help you to sleep. So when you sleep better, it reduces the sensitivity. But it's meant to reduce the sensitivity and then you move on with your life. It is not to reduce the sensitivity and get rid of the sensitivity and hopefully you never get symptoms. That will be hoping like the sun doesn't rise again or temperature can become zero. Right? So the main aim of taking medication for some, not all, is to reduce the sensitivity. Although we say it is not a severe disease, but the disease, it can still be very uncomfortable. Agree? It's not a serious disease, but it's still very uncomfortable. So we use medication to give some comfort to reduce the sensitivity. It's never meant to be a cure. If there is a cure, if there is a cure, it will be medication plus cognitive behavioral therapy plus whatever we're discussing. That will be closest to cure. Okay. Any more? Ada lagi sakit?
Dr. Phang, for anxiety disorder, who do we see first? Psychologist or psychiatrist?
Psychologist or psychiatrist? Assuming you have gone through all the process of assessment, diagnosis, everything done already.
Yeah, everything okay.
Everything okay already. Psychiatrist or psychologist? Okay.
Because you go to a hospital, you see both of them, a psychologist and a psychiatrist, but who do you approach first?
Okay. And this psychology in this context is a clinical psychologist. It should not be a counseling psychologist. It should be a clinical psychologist. So is it a psychiatrist or clinical psychologist? Okay. If your condition is severe enough that you need medication, again, the use of medication is the proper context is what I explained. It's never a cure. It's only to reduce sensitivity, make it more comfortable for you to learn the skill to cope. Whenever you think your condition is severe enough to need medication, then you will go to a psychiatrist. For example, if you have a panic attack, which is very severe, panic attack can be very severe. Although it's no severe disease, the impairment is very severe. You still need something to bring down the heart rate, relieve the shortness of breath. So you need medication, you go to a psychiatrist. Is that clear? Okay. Assuming you've also gone through that part, you consulted a psychiatrist, you already took some medication, symptom relief already. Then next, is it a psychiatrist or is it a clinical psychologist? Okay. The answer will be both also can, as long they're able to do cognitive behavioral therapy for anxiety. That's the most important part. As long that they are able to do cognitive behavioral therapy for anxiety with psychosomatic symptoms. Okay. Then the next question is, which one is more likely? A psychiatrist is more likely to able to do that, or a clinical psychologist is more able to do that? I would say generally clinical psychologist, generally speaking. But you still have to check with the clinical psychologist. Are you trained in cognitive behavioral therapy? The short form is CBT, not criminal breach of trust. You have to ask specifically, are you trained in CBT? And you ask specifically, are you trained in CBT for anxiety? It's very specific or not? CBT with anxiety, and the more experienced they are, the better. It is different from somebody who is just graduated. CBT, I know CBT. But compared to somebody who practiced CBT for anxiety for 10, 20 years. Correct? Okay. Ideally, but it's not the ideal, but it's not the common. Ideally, is to get a psychiatrist who is also trained in doing CBT for anxiety and psychosomatic. That ideally. But it's very difficult to get a psychiatrist to able to do that. And I happen to be one of those. I happen to be one of those psychiatrists who can prescribe medication, who can also offer CBT for anxiety. That would be the best because it comes to some of the questions, because a clinical psychologist is not a medical doctor. So certain questions you ask the clinical psychologist, they won't be able to answer you. For example, he asks a symptom. So is this symptom because of my anxiety, or is it the medication side effect or other thing? Because a clinical psychologist is not a medical doctor. He will probably say, if he's a good clinical psychologist, he will say that, sorry, I do not know. Maybe you go and ask your doctor. So the clinical psychologist will be stuck there. Whereas I'm the psychiatrist, I'm trained in both. I can tell you. In fact, I understand, because I'm also a doctor, I understand how other doctors think. I understand how other doctors think that I'm in a better position to help you interpret what other doctors say. But it's difficult to find a psychiatrist in Malaysia who is trained in both. So at the practical level, I would say if all the basic one done already and you got a little bit medicine, I would say the more practical one will be to find a clinical psychologist who is trained in CBT for anxiety. Thank you. Very practical question. I hope my answer is also practical enough. Yeah.
Hello, Dr. Phang.
Yeah.
I ask you, is this a ADHD, a disease or disease? ADHD.
What does ADHD stand for?
Attention Deficit Hyperactive Disorder.
Disorder. So you mentioned already disorder. So a disorder is a disease, but it's not a physical disease. ADHD, Attention Deficit Hyperactive Disorder, are people with attention problem. Either they have attention problem or they are hyperactive. Actually, three components. Either they have attention problem, or they are hyperactive, or they are very impulsive, very impatient, very irritable. So ADHD, because the word D, disorder, disorder is a disease. So in the psychiatry, in the mental health, sometimes the word disorder is used to replace the word disease. The word disorder, any disorder, panic disorder, they don't call it panic disease, they call it panic disorder. A major depressive disorder, they don't call it major depressive illness. So whenever there's a disorder, it's still a disease. That means it can be severe, but it's an emotional disease. It's not a physical disease. Okay. One last point. Any form of mental health related disorder, disease, there's always a normal variant. There's always a normal version of it. So there are also a lot of people with attention problem. When we have attention problem, not necessarily is to the level of disorder. Okay? So maybe I can expand the explanation further. So when you have attention deficit, it means poor attention. Poor attention as you cannot pay attention. It's not that you don't get enough attention. Poor attention can be disease. You cannot pay attention, then you cannot remember things well. Is it a disease? Of course, it's a disease. It's a disease. But it may not be very severe. But that can be very severe. That can be very severe, and very severe is called attention deficit hyperactive disorder. So understanding is very important. It also helps us to be more empathetic. So when people talk about attention problem, some of them they are talking at the disease level. Some they are talking at the disease level. So you can be more empathetic. It's more empathetic. It's not the normal in attention. Okay, or too lengthy.
Confused.
Okay, go back to your original question. You asked me ADHD, is it a disease? My short answer will be yes, it's a disease, but it's an emotional disease, not emotional attention, emotional mental health disease, not a physical disease.
That means
very simple.
That means a mental illness or what? Is it a mental?
Okay, if you understand mental correctly, then no problem. When we use the word mental, we mean it's related to emotion, it's related to the brain, it's related to the nervous system, then yes. If the word mental, you hear the people who are psychotic, those in Tanjung Rambutan, all those, then it's not. Then it's not. So it's a disease related to the brain, it's a disease related to the nervous system, it's a disease related to attention, which is also the brain. Yes. Right? So whatever mental has different meaning. Yeah. It is a disorder. Yeah.
Okay, thanks.
It's attended by psychiatrists, if you want to be more specific. It's attended by psychiatrists, it's also attended by clinical psychologists. Yeah. Yes, yeah. I'm happy to stay, but anyone of you, if you need to go, feel free to go. Yeah.
Hi, Dr. Phang. Since the brother mentioned about ADHD, I would like to ask if I have suspect.
You have?
I have suspect that if, let's say, my son might have ADHD, so where should I bring him to do the assessment? Where's the proper channel?
What is your son's age?
7.
7. Is Dr. T around? My colleague? Went out already. Okay, never mind. For 7 years old, for children and adult is a bit different. 7-year-old is still a child. I would say the best is you either start with the pediatrician or your family doctor, either one. Family doctor or pediatrician. You start from there. They will advise you on what to do. Because for children, the assessment is more complex. Because you cannot straight away jump to the conclusion is ADHD. It can be a lot of physical problems. Physical problem that present with attention problem. But actually it's not the actual brain and nervous system. It's more of physical, like hearing problem, eyesight problem, and other physical problems. So that is the rationale of I suggest you go to a pediatrician or a family doctor.
Pediatricians or development pediatricians?
Or if you can get a developmental pediatrician, it's even better. If you can get a developmental pediatrician, it's even better. It's always our accessibility. If you can get a psychiatrist also trained in CBT, for example, of course that is the best. But you can get developmental pediatrician even better, but it's not easy. Yes, they are, but it's not easy. So you can get developmental pediatrician even better. From there, at least a pediatrician deals with physical. You rule out all the physical. Then the developmental pediatrician will refer to other specialty. For example, whether a clinical psychologist or a psychiatrist, a child psychiatrist, or both. A child clinical psychologist or a child psychiatrist, or both. But you start with the developmental pediatrician.
Okay. Thank you.
I hope my answers are practical enough. I try to give practical, actionable answers. Yeah. Any more? Any more sakit? Or tak ada sakit lah? Okay, you're none. Very good. Thank you. Thank you for attending. Have a good weekend. Keep all of you safe, healthy, happy.